Welcome back to The Explainer. So if you're looking to truly understand the complex architecture of the human body, you are in the exact right place. Today we're taking a tour, a real architectural tour, of a beautifully engineered and honestly clinically crucial region. I'm talking about the posterior triangle of the neck. Now, instead of just memorizing a dry list of muscles, we're going to explore exactly how this space is built, literally from the ground up. Actually, do this with me. Take a second and just gently feel the side of your neck. Right behind that thick muscle that turns your head. You feel that? Just beneath the skin, right there, lies a hidden anatomical junction box. It's kind of crazy. It's a remarkably compact space, yet it houses the major vascular plumbing and the high-voltage electrical wiring that powers your entire upper limb and your head. Understanding this hidden geometry is absolutely vital, and not just for, passing anatomy exams. In a clinical setting, a single millimeter of error in this exact spot can literally change a patient's life forever. All right, let's dive right into this. Here is exactly how we'll break it down. 1. Mapping the space. 2. The walls. 3. Roof, floor, and subdivisions. 4. Vital contents. And finally, 5. Clinical impact. Let's get to it. Section 1. Mapping the space. So, if you look at this side of the neck, it's essentially a big quadrangle. But as we know, nature absolutely loves triangles. There's this massive superficial muscle, the sternocleidomastoid, that runs diagonally right across it. And what it does is slice that quadrangle cleanly in two. You get the anterior triangle in the front and the posterior triangle in the back. Notice how our specific plot of land here, the posterior triangle, has its wider base sitting flat on the collarbone, and then it points upwards and backwards, right toward the back of the skull. Section 2. The walls. Anatomical boundaries. Okay, let's define the walls of our room. The front wall is the posterior border of that diagonal muscle we just mentioned, the sternocleidomastoid. Now, the back wall is formed by the anterior border of the trapezius. That's that really large, flat, triangular muscle sloping down your upper back. The foundation, or the base of the room, is the superior aspect of the middle third of your clavicle, your collarbone. But here is the really interesting part. The apex, the absolute peak of the ceiling, is where the sternocleidomastoid and the trapezius meet at the superior nuchal line of the occipital bone. Because of how the human body naturally curves, this space actually spirals slightly from the front of the neck towards the back. So the literal peak of this room actually sits on the back of your head. Kind of mind-blowing, right? Section 3. Anatomy. Roof, floor, and divisions. Let's look up. The roof of our room is formed by the investing layer of the deep cervical fascia. Think of it like a really tight canvas stretched right between those two wall muscles, with superficial fascia and skin over the top. But this roof isn't totally solid. It's actually pierced by some pretty vital wiring and plumbing. Specifically, 4 cutaneous branches of the cervical plexus, the lesser occipital, the great auricular, the transverse cervical, and the supraclavicular nerves literally punch right through the ceiling near the middle of the sternocleidomastoid's posterior border. And joining them up there is a major piece of plumbing, the external jugular vein, running obliquely downward right across the roof. Now, if we look down, the floor of the posterior triangle is definitely not flat. It's a highly layered muscular foundation. Starting from the top apex and moving downwards, the floorboards are built out of 5 distinct muscles. We've got the semispinalis capitis, the splenius capitis, the levator scapulae, the scalenus medius, and sometimes the first digitation of the serratus anterior. Together, these form a really solid, albeit kind of bumpy, foundation for everything resting inside. But nature doesn't just leave raw floorboards exposed, does it? Laid perfectly over these muscles is a very specific, incredibly thick protective covering. This is the prevertebral layer of deep cervical fascia. It functions exactly like a fascial carpet. It covers the muscular floor, and as we're gonna see in just a minute, this carpet plays an absolutely crucial role in organizing the space and even dictating where infections might spread. Before we start furnishing the room, we gotta mention a small partition wall. The inferior belly of the omohyoid muscle crosses right over the lower part of our triangle, and it divides the space into 2 separate internal subrooms. The larger upper room is the occipital triangle, named simply because the occipital artery crosses its peak. Then you have the smaller, lower room called the subclavian or supraclavicular triangle, and that one houses the supravital subclavian artery. Moving right along, Section 4, Vital Contents and Nerves. The posterior triangle is absolutely packed with vital structures. First, you've got the third part of the subclavian artery, literally delivering the main blood supply to your upper limb. Then you have the cervical part of the brachial plexus. That's the massive bundle of nerves controlling your entire arm and hand. You've also got numerous lymph nodes acting as the region's localized immune defense system. And finally, you have the spinal accessory nerve, which is a major cranial nerve. So here is the crucial takeaway about how these contents are actually organized in there. Remember that fascial carpet we just talked about? Well, the subclavian artery and the brachial plexus are safely tucked away completely under that thick carpet. They're incredibly well protected deep inside the floor. But there's one glaring exception. The spinal accessory nerve does not hide under the carpet. Not at all. Instead, it runs just underneath the roof of the triangle. It's actually adhered right to the deep aspect of the fascial roof. Section 5. Clinical importance and injuries. All right, listen up, because here is a stark golden fact for clinical medicine. Because that spinal accessory nerve is stuck right up against the superficial roof of the posterior triangle and completely lacks the protection of that deep fascial carpet, it is extraordinarily vulnerable. If a surgeon goes in to biopsy or remove an enlarged lymph node just under the skin in this exact area, the spinal accessory nerve is literally the most commonly injured structure. And severing this nerve, it paralyzes the trapezius muscle, which leaves the patient completely unable to properly shrug their shoulder or even lift their arm above their head. It's a huge deal. But wait, the spinal accessory nerve isn't the only clinical trap waiting in this space. That fascial carpet we were just praising for protecting the deeper arteries and nerves, yeah, well, it can also act as a very dangerous, very slippery slope for disease. Check out this fascinating, if slightly grim pathway. Imagine a deep infection, say pus collecting from tuberculosis in the cervical vertebrae of the neck. That pus eventually hits the underside of our prevertebral fascial carpet. It's too thick, so the pus can't punch upward through it. So what happens? Following gravity and the path of least resistance, the infection just tracks downwards and laterally. You see, this fascial carpet actually extends downwards to form a sheath all around the blood vessels heading straight into the arm. So an infection that started way deep in the neck can slide all the way down this anatomical water slide, unsuspectingly popping up as an abscess in the armpit or even further down in the arm itself. No way, right? Honestly, it is brilliant engineering, but clearly with some major vulnerabilities. By understanding the walls, the roof, the floorboards, and that all-important fascial carpet, we can navigate this space with incredible precision. So, as you sit there right now, just think about that delicate spinal accessory nerve, gliding right beneath the surface of the skin on your neck, mere millimeters away from the outside world. Really makes you wonder, doesn't it? How perfectly yet incredibly vulnerably is your own nervous system packaged. Keep that in mind the next time you stretch your neck. Until next time, stay curious and keep learning.